Well, check this out. New 3D motion technology is changing the game for athletes recovering from ACL surgery.
The cutting-edge tool is transforming how doctors treat the patients. And as Fox 35's Stephanie Buff-Monty found out, it's helping one Kissimmee teenage pro get back on the soccer field.
No athlete wants to hear of an ACL injury, and going through the rehab can be difficult. But here at Orlando Health, they have new 3D motion technology that makes sure that these athletes are getting on the field when they should be and don't hurt themselves again. Lunges.
So go for it right here.
Squats, step downs, and jumps.
Go ahead and go all the way at the bottom. Jump. Perfect.
Physical therapist Simone Bossier put me to work to give me a first-hand look at the new 3D motion technology at Orlando Health's Jewett Orthopedic Institute.
Your single leg squat, for example, looked actually really good. But we can see, like, for example, here, there's a little bit of a difference between how far you're going on the left side versus the right side.
And that's what he's looking for with his patients, like Fabricio Mendez Diaz. The Kissimmee soccer player tore his ACL on the pitch, a common injury for soccer and football players.
And our bucket handle meniscus tear, which is here.
Dr. Andrew Carbone performed his ACL reconstruction surgery.
Go ahead and squat.
Ambrosio guided him through rehab using the 3D motion tech.
The technology was really crazy.
For Diaz, his body took a little more time to heal than doctors might have thought.
You're better off, again, prolonging your rehab, your recovery, to make sure that you're really good to go, as opposed to running the risk of a re-injury, because we do know that it's unfortunately far too common.
This technology is changing the game, helping doctors know exactly when an athlete is ready to get back on the field and avoid the risk of another ACL injury.
And we really didn't have any good metrics to really determine when someone was ready to go back or not.
But now with this new tech,
so we can kind of sense when a patient or a player is ready to go back based on how they move, and it provides much more objective, quantifiable data rather than just, hey, how do you feel, or how's your strength, things like that. With this, we can actually show pictures of them and show them where they're at risk and where they might, need to go back to the gym and work on some other additional kind of activities.
After months of hard work and recovery, this teen with dreams of going pro is finally back where he belongs, on the pitch.
I feel amazing. At first, I didn't think I was going to get this long with it, but, I feel amazing. I don't feel nervous, no doubts about it, and I'm just back on the field without thinking about, that I'm going to tear my ACL again.
Reporting in Orlando, Stephanie Buff-Monty, Fox 35 News.